Dear colleagues, welcome to this press conference to have an overview on the situation in Quebec as far as COVID-19 is considered. The Premier of Quebec, Mr. Legault, together with the Minister of Health and Social Services, Ms. Danielle McCann, and the National Director of Public Health Quebec, Dr. Horatio Arruda. Mr. Premier, thank you. Hello, everyone. Before going over the status report for the day, I would like to say something to Quebecers. First, I wish to say that I understand that some people are stressed. It's normal, because usually we don't have children at home. The elderly get visitors. Now they can't. I know that there are workers who have lost their job and are wondering whether and if they're going to have a job again. I know that there are entrepreneurs as well who have built businesses in their entire lives, and now they're wondering if they've lost everything that they've built. It's normal for us to be stressed out. We are going to be taking care of those problems as much as possible in the next weeks. But the priority for the 3 upcoming weeks is to avoid contagion. It is to avoid spreading the virus further. So we have taken strong measures, quick measures, to try to make it last as little as possible. So I get you. I know you're experiencing stressful times. It's normal. But what I want to tell you is that all of this is temporary. We're not stuck in this situation forever. It's temporary. And the more strongly we act now, the quicker we'll be able to get out of the situation. So we now have 1,013 confirmed cases, an increase of 385 cases. We have 67 people who are being hospitalized right now, which is an increase of 22. 31 people in intensive care, an increase of 11. And we are still at 4 deaths. So no increase. 2,500 people are awaiting results, test results in the next few days. 12,200 have already received a negative test. So I'd like to come back to the measures that we announced yesterday to close down all businesses that do not offer essential services. I wish to tell business owners, entrepreneurs, I understand your frustration. We received a lot of calls yesterday. We are adjusting the list, and amongst others, I'm thinking about certain manufacturing businesses like the aluminum plants. I understand very well that some minimal activity has to remain so that these plants can start up again on the 14th of April. So we get it and we accept it. I just want to tell you, I understand that many are frustrated. At the same time, it is important to repeat why we're doing all of this. We're doing it to protect the life of a lot of people. So these are measures that are hard for businesses. Of course, it's going to hurt the economy. It's going to hurt businesses. We, as much as possible, will be taking care of businesses after this. We'll be looking with certain manufacturing plants what the minimum activities that you can remain to be able to be ready to start again when comes the time to start. Yesterday, I had a telephone conference with Mr. Trudeau, as well as the other provincial premiers. I talked upon 3 subjects. The first, I repeated to Mr. Trudeau that the priority of priorities is medical equipment, particularly equipment to be able to do the screening tests. We have to be certain that we have sufficient equipment in the next few weeks and months to be able to continue doing more screening tests. That was the first subject, and we are working together on the supplies. The second subject, because we have a lot of questions, checks for employment insurance that will be given to those who have lost their jobs, including independent workers who usually don't have the right to have employment insurance who now will. Mr. Trudeau is telling me that the checks are going to be available on the 6th of April. That's in 2 weeks. We are having a look on our own end, the government of Quebec. We're having a look at what we can do for the people who are going to be needing liquidities before the 6th of April. I understand that there's the 1st of April, there's food to buy. Some people have lost their jobs and do not have an amount that they can depend on. We're working on that. The third subject that I spoke about with Mr. Trudeau is the Federal Emergency Act. According to me, I said that as far as I'm concerned, it is premature to adopt that law now. And I told Mr. Trudeau that at any rate, it is important that Quebec can retain all its flexibility and choose quickly all the measures that are appropriate to the Quebec situation. I understand that in an ideal situation, we could take the time to standardize everything in all provinces. But right now, the situation is different from one province to the next, and I think that it is important that Quebec keeps all of its leeway and flexibility in order to be able to set up measures quickly. So that is what I said to Mr. Trudeau. Now, I'd like to get back to the basic guidelines. Maybe there are people, I saw that on social media, who had perhaps, or maybe I'm probably the one who didn't express myself properly, but I want to be very clear. All those who do not work in essential services must stay at home. That's clear. But they can go out first to go get food, of course. Secondly, to help out people who are 70 and over to be able to get food for them. So for those people 70 years and over. And it is also possible to go have a walk as well. It's even good for your health. It's good for your mental health. You just have to remain 2 meters away from other people. So that's, those who understand this better, 6 feet. But you can go and have a walk. There is a restriction in residences and nursing homes, places where the elderly, we're asking when you go out to be under supervision. Why are we doing this? Because there are people who live in homes for the elderly who are scared when they see other residents go out. They are scared that those people are going to be bringing back the virus in the residence. So it is to reassure everybody that we are saying that as of now, you will be supervised if you leave. Another very important point to mention, this is not the time to have evenings with your brother-in-law, your grandfather, your friends. It's no time to have dinner parties. You'll be able to do that once this is all over, but now is not the time to do that. It's the worst thing that we can do. I would like to end by once again thanking all Quebecers. We see that there's a lot of solidarity. There are a lot of people who are also asking us where they can go help. And Jean Boulet is preparing a website, a web portal, where we'll be able to put all the organizations that are looking for volunteers regionally, and where people who want to be volunteers will be able to register. So in the next few days, we should be able to set that up. And it's impressive to see the incredible solidarity of Quebecers, and I wish to thank you for it. And I would like to end with the same sentence that I've been repeating since the beginning. The quicker we reduce physical contacts, the more we'll reduce contagion, the more lives we'll save, and more quickly we'll be able to get back to a normal life. So I thank you for your great collaboration. I count on you. And as an organization said, it's all going to go well.
I know we're going through difficult times. I know it's stressful for businesses, for workers, for families, for elderlies. We have to remember that all this is temporary. We are all in this together. Quebecers will help each other get through. We will continue to adjust the list of essential services. We're putting our economy on pause, but we're preparing to better restart it. In the meantime, everybody must respect public health instructions. The faster we limit contagion, the faster we'll save lives and return to a normal life. Thank you.
Alors maintenant, pour la période des questions en français, on va débuter aujourd'hui avec Olivier.
Question period in French. Mr. Legault, are you going to impose fines to those who are not respecting the guidelines, whether they be individuals or businesses? We're not there yet. We're counting on people's goodwill. Police officers are there to inform everybody, whether they be individuals or businesses. I am counting on everybody's good faith and goodwill for as long as possible. What is to be done with children in shared custody? I talked about I studied this file. It's not simple, but I want to say what Dr. Arruda said. The stricter parent is perhaps the one that should have the children right now. But regardless, ideally, children should stay with the same parent, but I can understand there are parents who want to see their children. It's just really important to respect the guidelines, all the guidelines of Dr. Arruda. Well, let's use an example here. And don't forget that the question depends on the principles, Parents, whose children go from one house to another, but they do the same thing. Sometimes the guys were perhaps not as strict. We went out tonight, went to a party. Well, I'll just give you an example. I would be stricter than my spouse, but it depends on people. So now it's a question of judgment. And I also believe that it's a question that parents can manage together. There is no miracle recipe, like pandemic, like these ones. We haven't experienced them. We haven't made any studies. And I think that people are sufficiently intelligent to understand. What we mean to say is that young people shouldn't, go have a party and when they're with one parent and then they go back to their mother and they contaminate the mother and the grandmother, you understand? I think that we have to depend on people's good judgment. There's a lot of worry in the healthcare network. You are conscious of it. I'm sure that you are probably overwhelmed with emails. What is being said is that the guidelines are not the same from one region to another, from one hospital center to another, particularly for the N95 masks, the ones that protect the best. Are there enough for all regions? Yes, there are enough for all regions. We review everything every day, and the guidelines are transmitted to all regions, to all the establishments in Quebec. We send the same guidelines. And there is a group that is working on that every single day, and it must be standardized. There are reminders. The Deputy Minister is speaking with all CEOs every day, and of course, you know what it is. We really have to make sure that it is well implemented everywhere. The questions that we're getting right now, that's normal. And we are resolving them. There were some in the emergency ward protocols that was reviewed yesterday completely. We gave new instructions throughout all of Quebec. There is a protocol that is being reviewed as far as ophthalmology or else. It is being done now very quickly. But I wish to tell you, as far as health workers are concerned, with the guidelines that we're giving the population, I believe that healthcare workers need to feel that they are supported by the population. And the support of the population is that each and every one of us do social distancing, in that we wash our hands and that the healthcare workers feel that the population is behind them, that we send them messages to that extent, doing exactly what our Public Health National Director is asking us to do. But as far as the protection of healthcare workers is concerned, I can assure you that we are making sure that every day and every hour of the day we are seeing to it. In emergency, you're telling us that protocols have changed, and one of the worries that was shared by the president of the Association of Emergency Workers is that to say that there are people who are getting through. Are you going to tighten the rules for when people arrive at the hospital? It's clear that we had discussions today with that. Anybody that shows up at an emergency ward that has infectious symptoms, fever, cough, sore throat, gastro, they must receive a mask that they will wear. They have to wash their hands, and that is standardized throughout Quebec. And we make sure, and we have everything that we need in terms of surgical masks to be able to give them to the staff, certainly, but also to patients who arrive with infectious symptoms.
Monsieur le Premier ministre, M. Arruda, Mme McCann. Il y a une personne qui
There is a person who wrote to me who is stuck with COVID-19, who is part of the 1,000 and some cases that have been identified, who is at home with symptoms, has fever, migraine, etc., loss of certain senses like smell, and is worried not to get any follow-up. Nobody has called her, no nurses, no doctors to go see her, or anything. What is the follow-up that people who are at home identified as having COVID-19, what is the follow-up that is being done with those people? Well, listen, you have to understand that when we send them back home, it means that at the time that they were evaluated, they didn't necessarily have any need to be hospitalized. However, if their clinical state deteriorates, they have to call back to be able to, because what you have to understand in terms of follow-up, there's not necessarily a treatment. There's no vaccine. There's no specific medication. People can take, medication to reduce the headache and things like that. But if the fever deteriorates and at any symptom, imagine, for example, if we do a follow-up, we go in the morning and it's fine, and in the evening it's not. Those people have to call so that they can get re-evaluated if needed. I mean, I imagine if the nurse went every day and saw the same thing every day, but it's at night that it took place. The message to give to people is that if you're not doing well, if your state deteriorates compared to what it was, call to be re-evaluated. And I'd like to also reiterate what I said a few days ago. Our doctors in medical clinics are doing consultations over the phone more and more, and even teleconsultations. So if those people have a doctor, they can call them if they have any concerns, and they will be answered. If they do not have a doctor, they can call a clinic in their neighborhood. So we're not, just abandoning them. They do have the possibility of calling their doctors or a clinic, and they will be answered. Second question. This has to do with what I was saying. I'm going to read you an email that was sent to me. I'm a nurse in a Montreal area hospital. I'm speaking in the name of my colleagues. We are tired that the Premier calls us his angels without giving us more equipment. We don't have enough masks. We don't have enough hats. And we want to know whether there will be an increase in wages or risk premiums. Please communicate those questions to the Premier, and the person identify themselves. It's not an unknown person. So will there be a premium, and will they be assured of having the equipment? Well, first of all, every morning, one of my first questions to the team is, are we missing any equipment? And I've been told no. Are the guidelines applied well everywhere? There might be exceptions, but our intentions is that all of the staff be protected with all the necessary equipment, caps and gowns and everything. Now, as far as the premium is concerned, there are conversations that are taking place right now with the unions, and that is part of the discussions. But there is nothing that is firm for now.
Oui, bonjour. Dans la foulée des questions de mes collègues, Mme McCann.
Ms. McCann, what is the number of workers who have been infected by COVID-19 in a hospital setting, so health professionals, and why having increased the protective protocols in emergency wards and the screening of patients? Well, listen, the number of healthcare workers, to date, there are 4 healthcare professionals who have been infected, but they were infected following travels. So I have no knowledge that there's any other healthcare workers who have been infected. As far as the enhancement, well, that's good. That's part of good practices for infectious diseases. But what we're doing now is that we are broadcasting the message very strongly so that all establishments follow those measures, for example, wearing masks when you're in an emergency ward or when you arrive as a patient with symptoms, infectious symptoms. Of course, in the present situations, we have a virus where there's no medication, there's no vaccine. We have to absolutely increase these protective measures, and we're ready to do so. Dr. Arruda, if you'll allow me, yesterday you let it be known, as well as the Premier, that the crisis could be more serious because of the spring break, which is earlier here than in the rest of Canada. According to the most probable scenario, at what moment would we be at the tipping point of the crisis or the peak? And I understand that it's difficult, but with the information that you have today, do you regret not having canceled spring break? Well, maybe I can start by saying, let's remember that when we had spring break, we were not in the situation that we are now in. And our spring break, you have to understand that it was before that of Ontario. So it arrived at the wrong moment. When people started coming back from spring break, that is where we started emitting stronger measures. So I do not believe that we can say that we regret anything. On the contrary, I think that all the measures that we've taken, including the closure of non-essential businesses, I think that in Canada, we are the province that has done the most. So no, we are managing things. Now, that's why we've said 3 weeks. There's a reason for that. We hope that it is a period in which we will be able to start seeing stabilization. First, spring break is not the problem. It's the travels, because, if all Quebecers had taken their week off in Quebec and had not gone outside in France and Italy, where a lot of, the symptoms appeared, we wouldn't have had a problem. So it's the introduction of the virus that arrived through people who had been exposed elsewhere and who got ill here, or even who had symptoms as they arrived. The only thing is that our timing, before we closed down the borders, we already had people outside. Do you understand? So whereas elsewhere, their spring break being later, the borders were closed earlier, transportation went down earlier, that's a phenomenon on which we can't, go back. It would have been introduced here one way or another anyway, eventually, because this is going to go around the world. Our objective, through these intensive measures that we've taken and that we're setting up now, don't forget, is to flatten the curve. Because according to the measures that we're setting up and the measures that we're going to continue setting up in order to avoid exposure, well, we will have the flattening out of this curve. So the peak, because don't forget, the peak, what we want to avoid, if we had unlimited treating capacity, if we had the capacity like no country has in the world, we'd be able to say, well, we'll get through it, we're going to treat people, and, But even by delaying things, maybe new medication will arrive. The vaccine, it's more complicated, but our knowledge is going to be better for the therapy to be given to people. So would be a winning situation. Clinically, as a society, and I will repeat it, our populational treatment, which I've prescribed to everyone, is going to work as long as everyone does it. It's like I told you, the dosage is being shared out amongst everybody else. If 40% of the population doesn't do it, I don't have the efficacy that I'm supposed to have. And it's difficult. It changes everything. It changed my life. It changes everyone's lives. I no longer go to Montreal right now. I'm here. I can't allow myself to contaminate anybody around me. So this requires a lot of effort, but we can do it. We can give ourselves that break. We just have to do it adequately and understand the reason why we're doing it. So the priority for federal government is the supply of medical equipment. How much do we have now? Well, we have a few weeks' worth, but we think that the crisis is going to last more than a few weeks. So there's orders that have been made. Now we have to know whether those orders are going to be respected, whether they come from the United States, Europe, or Asia. So it is important that the federal government help out to ensure that after those few weeks, we will continue having all the necessary equipment. Yesterday, you briefly talked about the situation of moving, but there are many people who have testified since then. Tenants cannot prevent visits in their apartment according to the law. Some people bought a home who haven't gone in front of the notary yet, and there are people who have to move to different regions where you're asking people not to go from one region to another. Could you talk about the moves right now and in the future? Right now, what we're saying is we're taking a break for 3 weeks. So in an ideal world, there's no visits to apartments during those 3 weeks. There are laws that allow for owners to have the apartments visited, but I would ask those owners to, don't. As much as possible, don't make other people visit apartments in the next 3 weeks. We're conscious of the problem. You've seen movers that are in essential services. We know what's coming up, and we know what's going to happen on the 1st of July, regardless of where we're at. But now for the next 3 weeks, please, no visits to apartments. As far as notaries are concerned, for the time being, we haven't judged that it's an essential service. But depending on how long the crisis will last, we may review that. The quasi-total stoppage of business, is it going to have consequences on people's lives and companies' lives for the next few years? And what are the measures that you have taken to be able to help those businesses? Well, yes, in fact, the measures that we took yesterday are going to hurt the economy. There are sectors as well. We may think, for example, that people are not going to travel as much in the next few years, not in the next few months, but in the next few years. So there will be consequences to this crisis. As far as international movements are concerned, for example, it's really early right now to be able to answer those questions. What I wish to do is to be ready. There's a team around Peter Fitzgibbon that is getting ready. As soon as the end of the crisis can be seen, we want to be ready to quickly relaunch all of our businesses. That's what we're doing. But in the short term, the priority is to take care of individuals. So all the people who are no longer getting an income so that they receive an employment insurance check or something equivalent, or social help. So in the short term, individuals, in the middle term, and we're getting ready for that now, as soon as we can relaunch things to be able to help. And that is why we are flexible with certain manufacturing companies, because there are companies that if they close down completely all of their operations, they won't be able to start again on the 14th of April. If we start that on the 14th of April, it starts again. So we have to, be able to accommodate so that certain companies can keep a minimum of activities to be able to ready to start again as soon as we give them the okay. So we are being compliant with that. The regional public health says that there are obvious cases of community transmissions. Is the situation still under control in Montreal, and should extra measures be taken to limit community spread in Montreal? Well, we told you that there was going to be community transmission at one point. The question of traveling, that it wouldn't be the question anymore. And I'm not going to debate with numbers because that is what I've seen in the media, and it's probably what's been said. But probably on the investigation, they probably can't identify a traveling source that's clear. So that means that when we start having less travelers that we know that they just came back, and fewer people who have been in contact with somebody that we know just came back from a trip, what we can say is that there's local transmission. There is local transmission, and probably not just in Montreal. There probably is elsewhere as well. It is different from one territory to another. And in fact, the measures that we have already set up of social distancing right from the beginning and all of that, and if you will allow me, this break that we're taking right now, that is one of the ways of decreasing transmission. Local transmission as such. We're not at the stage, or that is, we are still at the stage when we are still investigating every case. We're not yet at a stage, which is going to be coming later, depending, where we won't be able to investigate every case anymore in terms of quantities. Investigations in Montreal, even if it required many resources in terms of quantities and training, they're still being done. Every time we have a case that is positive to COVID, somebody starts calling. And at one point, we call it a transfer approach from public health. We won't do it individually. We will do it massively. And what we're doing right now, isolation measures, break, lockdown, that's what we're doing. But we are continuing combating situations to be able to decrease things even more and stop secondary transmissions. So I think that right now, the virus isn't everywhere in Quebec yet, as such, but there's starting to be more in certain places. We are still trying to decrease it as much as possible. And the measures that we're taking, when we tell people to not go from one region to another, it is to avoid re-implementing elsewhere the same phenomenon. It's normal that around Montreal, with the population that we have, with international flights, that there are more people who traveled in Montreal from the outside, and that this brought about transmission. We are in that phase right now, but we're still in the phase where we investigate every single case and what's going on. But the measures that we've set up, and that we set up right at the beginning and that are continuing, that is the response that we could make. Mr. Premier, you talked about an increase in stress and anxiety in the population. Do you fear that there may be an increase in social tensions? And what's the message about this? Well, yes, that is why I'm saying that up until now, and for the future, we're asking police officers to inform people. It's important that there not be any chaos in the city, in the society. That's why we decided to leave the SEQ and SCDQ open. We don't want people to rush, to those stores. We don't want to end up with problems of certain people in healthcare. So we're trying to set everything up so that there not be any chaos, despite the normal level of anxiety, despite the normal level of stress. That is why I'm telling people, don't be surprised if you feel stressed out. It's normal. It's as if all of a sudden our world had changed. So it's normal to be stressed out. So yes, go have a walk, but be careful. Remain 2 meters away from anybody else, but go have a walk. It's good for your morale. Are there any situations where there's been, spillovers with people who are tense? Oh, just really exceptions. Mr. Premier, still talking about the economy. There are entrepreneurs who are completely, they're talking about catastrophe. With what you announced yesterday, would you welcome the idea of giving businesses wages, subsidy wages, to allow them to keep the workers that they would have to lay off otherwise, to replace employment insurance? It perhaps is more the federal government that could take that decision, but would you be favorable to this idea, and could Quebec adopt such a policy? Well, it's an idea that was launched by Serge Dorent, the president of CGI, with whom I spoke 2 days ago. The idea is to have, strategic companies like CGI want to keep their employees. So they would prefer that the employment insurance checks that come from the federal government go through the companies to be able to keep that link of employment and to be ready to start again. So that is part of the discussions that we are having with the federal government. Of course, it's complex. It's money that is destined to individuals that comes from the federal government, so that is a federal decision more than anything. But I also understand, for the time being, there's a measure of the federal government, 10% of wages when the company keeps the employee. It's not very much, 10%, when, a business has thousands of employees. So we're looking at all sorts of alternatives, but I understand very well the objective of the measure. The objective of the measure is to ready to start up again when we get there, and to also make sure that our strategic businesses, and we talked about it a lot in the past few months, all the information technologies, for example, where we had a lack of employees, a shortage. I can understand certain companies that they're stressed out at the idea that they might lose this link to employees, especially in those sectors. So we're working with them to try to find solutions, and we're talking about it with the federal government. To come back to the increase of cases, it's a second significant day where the increase is very significant. Yesterday was partially explained by the fact that the methodology had been reviewed, which is not the case today. Should we understand that this is a new normality of things, that as of now there will be important increases every day? We should get used to it? Well, you have to understand that we're increasing the number of tests as well. And before, it took over 2 days to get the results, and now we are getting to that maximum delay of 2 days. So even in today's data, we might think that there is also some of the results that come from the increase in the number of tests. So we hope that in the next few days, the increases won't be as high. English?
Mr. Legault, you said that with your talks with the federal government, your priority number one is medical equipment or medical devices, and you put some orders. You have medical equipment for the next few weeks, but it's coming from the USA or Europe, so you don't know yet if the orders will be respected. So what's your take today, and would you be willing to consider sharing ventilators with other provinces?
Yeah. I discussed this morning with Doug Ford, Premier of Ontario, about ventilators. So he's also working on that with some companies, and we may be able to get a lot of ventilators from a company in Ontario, let's say in the next month. So we have to have a bridge, but it's a possibility. We look also with about 15 companies in Quebec, so for ventilators, masks, and all the equipment for testing. So we're looking at that. I'm speaking with Doug Ford, and we're trying to look at B plan, but also we continue to push for more orders everywhere in the world. And as you know, the situation is not as bad as it was in China, even if they continue to have some cases. So we hope to be able to get some equipment from China.
We had many questions about the fact that people can still access alcohol at grocery stores or dépanneurs, convenience stores, but you want the SAQ and the SQDC to stay open, to remain open. You're basically managing you're trying to avoid any chaos in society.
Yeah. First, I don't want to see any chaos in groceries to get some alcohol if we close the SAQ. Second, I think some people, unfortunately, they need to have some alcohol, so I don't want to bring those people in the healthcare network. And I think that also for to reduce the stress, you have to do some exercise, so have a walk, but sometimes a glass of wine may help.
So now a few questions sent by email from our colleagues. The first one is from Philotier, Montreal Gazette. Many people have a July lease. They need to tell to their landlords what they're doing by March 31. What should tenants and landlord do since there is so much chaos?
Okay, I would separate cases between the next 3 weeks. So as much as possible in the next 3 weeks, I wouldn't like to see people visiting apartments in the next 3 weeks. Of course, we know that there'll be a rush for July 1st, so we get prepared for that. But for the next 3 weeks, I would like to ask all landlords, please, no visit.
Another question for Mr. Arruda. Can you tell us how widespread community transmission is in Quebec? What does that mean for how Quebec is trying to slow the spread of COVID-19?
Well, it is clear that we would shift from acquired the disease in travelers outside of Canada. They're going to introduce it. Actually, we are doing inquiries to take care of cases and contacts. and it's normal. There is, and as I'm telling you, transmission here in Quebec, it's clear there is. And there's going to be more and more as the travel issue will stop. The ones who are coming from traveling, please stay at home for not transmitting that. And we will see that appear. But we still are doing, I would say, a case management, case by case. But what we had as measures at the beginning and now with that pause is going to help to lower this transmission at the same time as we did when we do people coming back from travelers. So there is transmission. There is probably some cities where there is more, where there have been more cases. But I think we must consider that there is transmission, and it's why we are asking people to stay home for not getting it from somewhere you don't know.
Talking about that, the next question is from CTV. How should people infected with COVID-19 or with symptoms self-quarantine at home when they live with other people, especially infants?
Well, in fact, if they have symptoms, it will. If you're a case, most people can be at home and try to not be infecting others. But in certain situations, we are going to really actually looking at if those persons can go somewhere else, not being in contact, especially if you have a small place with a lot of people. Perhaps it's going to be able to go or to a hotel or to a specific place by regions to make sure that we can respect that. But if you have a house with 3 stairs and 4 bathrooms, that's a different situation. So we're going to adapt those issues in relation to the vulnerable clienteles and the story of people. We are preparing those places everywhere in Quebec.
Second question for CTV. We've heard from many Quebecers who say that they do not work for an essential service or business as defined by the government, but those employers are demanding that they continue to work. So what recourse do they have? Who should they contact about this?
Well, I think that if they are convinced that they are in the list of essential services, they can stay at home, and we'll take care of that after.
All right, and our last questions are from Rachel Fletcher from Global News. Will there be any more help for small or medium business owners?
Yeah, of course. Right now, the priority is healthcare, but we're already working on plans for small businesses. The plan we announced was for a loan of at least $50,000, but we're already looking for smaller companies, what can be done in the FLI and FLE programs in each MRC.
And the last question from Rachel again. You have voiced concern about medical equipment. Can you update us on the number of medical equipment currently available? How many acute care beds and ventilators do we have? How long will these last?
Okay, so for ventilators and other critic equipment, we have for a few weeks. We already have discussion with the federal government. It was my top priority last night in the conference call. We also have some discussions with Quebec companies, and also I had a discussion this morning with Doug Ford to see if some companies in Ontario can help us faster than our companies.
Thank you very much. Merci tout le monde.
Merci tout le
monde. À demain.